Hey, what's up guys? My name is Amya and this is Tiaja, and today we're going to be going over the anatomical terminology of the human anatomy. Man, that is a mouthful. So, let's get started. So we can use our friend over here. This view, which is the frontal, the face and the stomach, also known as the anterior or ventral view. And when we turn our friend around, this would be the posterior view or the dorsal view if you were an animal. How you can remember that? Do you know a way how you can remember that, Tiaja?
Oh yeah, one way I like to memorize it is the back, which is the dorsal. I like to think of it as a dorsal fin, kind of like a dolphin or shark.
Okay, so let's continue. You know when you're lifting a weight and stuff like that, like you're trying to impress your girlfriend or something, and you're lifting it, that's called a flexion. Kind of like you're flexing your muscles, right? And let's see, when you're stretching your arm out like this, when you're moving it away from your body, that's called abduction. Abduction. Do you know a way how you can remember abduction, Tiaja? When you're moving it away from your body?
The first thing that comes to mind is aliens taking something away.
Yeah, that's true. That's an easy way, I guess. And when you're bringing it close to your midline, that's called adduction. Abduction is moving it away, and adduction is moving it closer. So, when you're laying, say you fall flat on your back, right? This is called a supine position. Another way to memorize supine is,
I think you might want to knock this one out.
Alright, it rhymes with spine. So that's how I remember it, since you're laying on your spine. And when you roll over to your stomach, that's called a prone position. So, that's pretty much the anatomical terminology so far. Let's go over the skull, shall we?
Oh, wait, before we go to the skull, I just want to give you guys just a brief introduction of what the axle skeleton is. So, most animals, not most, but a few animals on Earth, octopi, squids, earthworms, mollusks, they don't have what we call an axle skeleton, which is the basic building blocks and fundamentals of the skeletal system. They don't have one because they don't really need one. They don't have to fight gravity like we do, being underwater as they are. All they really need is a complex system of muscles and nerves, and they're pretty much good to go. While for humans, in order to walk upright or simply just sit down on the couch, our bodies have to constantly fight against gravity. And because of this, our bones, first of all, we need a bone structure, and it needs to be, solid, strong, and rigid.
Yep. So, let's get back to the skull. Pass me that. There you go. Where the axle skeleton, the rest of the spine goes through, there's a hole in the skull right here. And that's how it connects to the brain, so the nerves can get in there from the brain down to get to all our bodies, so we know when we're getting hurt or we know whatever's going on.
Sending different signals to the body, right?
Yes, exactly. So, here's the frontal part of the brain. Also, if the brain was in here, this would be called the frontal lobe, this would be called the parietal lobe, and this would be called the occipital lobe. And the temporal lobe is on both sides of the head, close to the ear. If the brain was here in this head, which it's not, but if it was, the frontal lobe controls emotion, the parietal lobe controls balance. The occipital lobe, it's pretty cool because it controls sight, and the eyes are in the front of the head, but it actually has nerves going this way and this way to get to the eyes so you can see. It's pretty cool. And the temporal lobe, of course, controls hearing. So, anything you want to add about that, Tiaja?
Yeah, sure. One thing you probably forgot about was there are these ridges in the skull right along here, which form, like my sister mentioned, the four plates of the skull: parietal, frontal, occipital, and temporal. And the reason, in case you're wondering, why are there ridges and grooves, as they're sometimes called, along the skull, and this is very simple. When you're an infant, your bones haven't taken a solid form yet, so they're really loose, almost gelatinous. And in order for the childbirth procedure to be successful, your head has to be flexible enough to squeeze. So because of this, your skull, it has to kind of break down in a way. So it's not one solid piece of flat bone. If it was, it wouldn't be able to bend, and then it'd be all bad. So basically, what happens when you're born, you have almost like these gaps, almost in your skull. And over time, what happens is once you reach a certain age of maturity, your skull plates begin to form together, and they create these ridges along the skull.
Yep, that's why they always say, don't press a baby's head in the middle because it hasn't formed yet. And we also forgot the mandible. Without the mandible, what would the skull be called, Tiaja?
I do believe it'd be called the cranium.
The cranium. And the mandible is a removable part from the human skull. So I just wanted to add that. So let's get into the spine.
Spine.
You know anything or two about the spine?
So,
And the vertebrae?
I do know some things about the spine. First being that there are 3 major portions of the spine itself. There are 3 distinct bones. There is the cervical. Cervical. There is the thorax, and there's the lumbar. And basically, these 3 different portions of the spine, they vary in shape and definition due to their specific task or whatever they have to do in the body. The first one, the cervical, is it's a roundish, almost like a plate. It's a roundish plate with a hole in the center, much like a donut. And basically, what it serves is, like Amya mentioned, there's a hole right here. It starts right here, and basically, it allows free passage for blood to flow to the brain and throughout the rest of the body. It also helps give out cervical fluid, nerves, protection, etc., etc. Because it kind of suck if someone came behind you and was like, "Hey, how's it going?" And they hit you in the back and they hit your nerves and I can't see.
You break
I can't
down.
breathe.
Your fingers are shaking.
So they also serve as protection. The thorax bone, it roughly, looks about the same as the thorax, or not the thorax, excuse me, but as the cervical. But it has a really sharp, or not sharp, but elongated bone sticking out from the side. It's a lot like this. And if you put your hand on your back and you feel around it, you should be able to feel it. And the hole inside the thorax is roughly around the same size. Finally, we get to the lumbar bone, which is the thickest bone in the spinal column.
The thickest.
And the reason this is because it has to support, all your weight on these bones. So it's very essential that it's very heavy and thick. The hole in the center is much smaller in proportion to the cervical or the thorax. This being because most of the things that need the most nerves or the most blood generally end before you reach the pelvic section. And I forgot to show you guys this, but the cervical spinal column starts here, ends about here. The thorax starts here, ends about here, and the lumbar begins right here and ends to the beginning of the spinal. Or not spinal, excuse me. What was it? The pelvic region, right?
Yeah.
And it's right about the pelvic region.
An easy way to remember lumbar, by the way, is I used to think of lumbar, which is pretty thick, and that's how I remember that the lumbar is really thick. So, yeah,
right.
So let's move on to the bone, upper extremities, and the hand. So, let's see. Let's use my arms for example. So, let's start off with this bone. This bone is called the humerus. And how I remember the humerus is we have the funny bone and the humerus. That's how I remember mine pretty much. And then we have the radius and the ulna. And then I remember ulna because in Latin, ulna means under. And then the ulna is underneath the radius. So that's how I can tell the difference between both the bones. So let's get into the hands. So the first fingers that we have, also known as phalanges, that's what we call them. And then we have the metacarpals, and then we have the metacarpals, and then carpals. Gosh. Alright, so that's pretty much everything going on over here. Oh, and we have the scapula. I mentioned this in one of my earlier classes, which is a very important bone. We have these bones that protect our bodies, like plates, I should say, like the sternum. The sternum protects the heart, and the scapulas protect the lungs. That's why there's 2 on both sides. So,
Right, so, we're just going to be a little bit more specific on the hands. There are roughly around 27 bones in the hand.
Yep, just about.
27?
That's right.
And 14 of those are in the fingers. And so, your hand is, it looks fairly simple on the outside. It's pretty complex on the inside. And, little known, what?
Well, what's different between the
Right,
male's
right.
hands and
So
the
a
female's
little known
hands?
fact about the hands of the human body
Mhm.
is that for most males, their index finger is going to be smaller in proportion to their ring finger. If you can look at mine, it's not very drastic, but it's very, very slight. You can kind of tell. My index finger is smaller than my ring, whilst for most women, their index finger is roughly around the same size as their ring finger. If you look at my sister's hand right here, you look at their two fingers, they're just about the same size.
Yep, just about.
Um, Anything else you should go over with the hand?
No, I think we covered it all. Great job.
Alright, let's keep going.
Alright, so now we're at the major muscles.
Major muscles of the upper extremity.
Yep.
So muscles of the arm serve both as, like an anchor
Mhm.
to the arm, holding stuff down. I mean, because they're kind of gross if your skin kind of just flimmed around.
Yeah, they help it
muscle.
hold together.
Muscle kind of gives your body definition.
Mhm.
As well as, it allows your body to, perform certain tasks, pick up a piece of water,
Do
throw
the flexion,
things, flexion, extension,
abduction,
etc., etc.
adduction.
One of the major bones in this particular section is called the trapezius.
Yep.
Trapezius, and it's a triangle-shaped muscle located around the scapula. And before I continue, I just want to let you guys know that the scapula is kind of like a free-flowing bone. It's not really attached to your clavicle. It's just the reason why I said free-floating is it's not really attached to anything at all. It's just there, and what keeps it in place is it's it's bound together by constricting muscles that are you're compact in that particular area. So it's not going to go anywhere, but at the same time, because it's not connected to anything, it allows free movement throughout your arms, your shoulders. You can do this backwards, sideways, left, right, etc. And basically, it starts at the base of your neck, and then it fans out around here, and it allows you to move like this. Like if you put your hand on your shoulder right here, and then you move your hand up and down, you can kind of feel the muscles contracting up and down.
Pretty good. So now we're on bones of the lower extremity. Am I correct?
Lower extremities.
So let's get this started. So our first bone that we have right here is called the femur. Is there anything special about the femur, Tiaja?
I can tell you this much: it is the longest and the strongest bone in the human body.
And what would happen if you broke this bone?
Excruciating pain. That is, my friends, the most painful bone to break in the entire human body.
You break this bone, you can kiss your sports career goodbye, or anything you plan to do.
Just anything goodbye. That is painful. The end.
Yep. And then we have our patellas right here. Helps move our legs around. And then we have our tibia and fibula, right? Is there anything special about the fibula?
Why don't you explain it, man?
Anything? Okay. So so we have the fibula and the tibula, right? And the tibia, it doesn't do. It was the fibula, right? I'm getting so confused with all these bones, right? Fibula. So the fibula, is the bone. It doesn't do anything. So we have the tibia that can just it helps support all the weight in our body, but the tibia, it's just the bone there for. I'm sure there's a reason.
What else I mean? You said the tibia?
You said the. I said the fibula.
No,
I said the fibula. That's
you
what I
said
said.
the fibia. Excuse us.
I just said the fibia. Anyway, my brother's confused. So, anyway, the fibula doesn't do anything. So if you just broke that bone, it would just be like a sharp. Well, not sharp.
Well, no, I mean like if you break the bone, it's gonna be painful. But
well, it's gonna be painful, but like it's just gonna be a little point there.
It's not gonna really affect anything else in your body.
It's nothing really so much. And then we're gonna go down to our feet here. So if you could pretend that my hands are feet, they do have phalanges, which is like the toes, pretty much. And then instead of metacarpals, it's metatarsals. So we have metatarsals, then we have tarsals. And then am I missing any bones in the foot, Joshua?
Did you mention the phalanges, right?
Yes.
There's also something on your foot. Let's pretend that my thumb is my big toe. It's called the talus. Excuse me. And the talus basically helps support and keeping balance, other such things. And I think there's one more, Amya. What was it called? The calcaneus?
Calcaneus?
Calcaneus, yeah. It's very difficult word to pronounce, but the calcaneus, which is located on the opposite side of where the talus is located. Right about here, it also helps in assisting with balance and takeoff.
Yep. So that's pretty much the lower extremities. We talked about the feet. Did we talk about the pelvis though?
No, I don't believe we have talked about the pelvis.
Let's get that covered.
So basically, the pelvis is located right here. It's your hip. And my favorite word. This is the best name. No, I'm serious. This is the best name for the bones in the entire human body. It's called the ilium of the crest.
That sounds like a movie title.
That sounds great. The ilium of the crest, which is located right here on the sides of your hip. If you put your hands on your hip right here.
You can actually feel it.
Through your hip, you can feel the bone. You can feel it going around and curving, forming the crest. Then on the inside, you have just the ilium. And then on the inside, located in the back of the pelvic region, which is right about here, you have the sacrum. Maybe you want to talk about the sacrum real quick?
Nah, this is all yours, man.
Alright, so the sacrum is, in other words, it's the tailbone. It has around 6 holes towards the back. And, these holes allow nerves to get through, send different messages, and deliver certain things throughout the human body. But it's a very distinct bone. You can't really miss it because at the tip it has a curve, a lot like a tail. Only, it's inside your body.
Oh, Tiaja, hold on. I really do have to add something to this. I gotta tell you a little story. So, I was doing this trapeze art things with my brother over the summer. We were at the youth bridge program. And I accidentally fell the wrong way when he said let go. So when I fell, I accidentally fell hard on my tailbone right
Ouch.
there. And it was fractured or broken.
I believe you fractured it.
The thing that the doctor told me, they couldn't do anything about it. The only thing I just couldn't sit down. I was sleeping funny. It was bad. If you don't want to break anything besides the femur, it is the tailbone.
Because
believe me.
The sacrum it's where you sit. Come on,
yeah,
that's painful.
It's super painful. Okay. So you want to review now?
Right. I think we can go over a couple specifics real quick. The femur, which we went over right here, it locks into the pelvic through a little ball. You can kind of see it with this right here. Now this is obviously exaggerated, but the femur attaches itself to the pelvic region through a little socket. There's a socket and there's a ball. And the ball fits in the socket a lot like this. So, it allows the leg to free swingly back and forth, left and right. Because it is really loose because it's not held tightly together like the radius and the ulna. So you can do these. You can kick out like that.
I think that's pretty much it. Is there anything else?
We went over the skull. We went over the
skull. We went over the feet. We went over the upper extremities. We went over the
lower extremities.
We went over the anatomical terminology. So let's review.
Let's review. All right.
All right. So as we said, the anatomical terminology. I told you that was a mouthful. So which is the face and the belly, the front side, the posterior dorsal side. Remember the shark fin. So that's how you know it's the back. And then flexion, like you're flexing your arm, trying to impress your girlfriend, or abduction, like the alien thing, remember, like they're trying to abduct your body. Adduction, bringing it back to the midline. And then we went over the skull, the frontal lobe, which controls emotion, the occipital lobe, which controls sight, which is pretty cool because it's in the back of your head, and your eyes in the front. Temporal lobes are both on the side,